Welcome to Matrescence Unfiltered, the podcast exploring what really happens to your identity, ambition, and career when you become a mother. Matrescence is the transition into motherhood, and it's one of the biggest identity shifts a woman will ever go through. Yet, when it comes to our careers, it's still barely understood. So often, motherhood gets framed as something to push through and bounce back from.
We think it's something else entirely, a capability shift, and we think it's time to name it and to talk about it properly. I'm Rose, coach, consultant, and researcher completing a master's in organisational psychology.
And I'm Bianca, a chief marketing officer, pregnant, and living this experience in real time. Each episode, we take one belief about motherhood and work that doesn't hold up under scrutiny and break it down properly.
Using research, lived experience, and honest conversations about what sustainable high performance actually looks like when your identity is shifting.
Welcome to Matrescence Unfiltered. We're really glad you're here.
Before we get into today's episode, I just wanted to share a quick sensitivity note. This episode discusses birth trauma, emergency caesarean, and the emotional aftermath of a birth experience that didn't go as planned. If you're currently pregnant or in early postpartum, please listen with care. This is not an area of my expertise in my research, is the actual birth plan and the complications that come with it. I know we've got some stats and some data that we can go through. So I'm very excited to get into today's topic, which is when nothing goes right in your birth plan.
This is going to be a pretty raw episode, I must admit. And it feels like a very important one for me to record because I'm 2 weeks and a few days after giving birth. And I've mentioned in previous episodes how much I was working with a doula, how excited I was, and the empowerment that I felt to put a birth plan in place. So, as the title of this episode suggests, my experience of having a birth plan was that nothing in my birth plan went to plan, apart from the healthy arrival of my baby boy, which is, of course, big disclaimer, the most important thing. But it did bring up some things. And I'll start with a stat that really struck me because it speaks exactly to my experience. A study was done with 119 women who were interviewed about their birth experiences, and 65% of them identified feelings of failure. Women are attributing those feelings of failure to themselves. They have shame around what happens in birth. They feel that it's all their fault. And the purpose of this conversation is to share my story, but to also have a conversation in solidarity with all the women listening to this who have experienced those feelings, because there are so many of us, and all the women that are yet to give birth in the knowledge that they're not alone when things don't go to plan, because this is one of those things in life, giving birth, where you have to, as much as you can plan, as much as you can try, as much as you hope, and we hope for a certain type of birth, sometimes things happen that are completely out of our control. So here goes. Let's get into what happened at my birth.
I think it'd be really good to get an understanding of like how you put together your birth plan. You know, I guess with any plan, a lot of time and thought goes into it. So I think it'd be really interesting for us to hear how you went about putting your birth plan together. And then when you, at the moment you realized that that was no longer going to happen, like how you navigated that.
Okay. So I think it's helpful to go back and share why I was so keen to work with a doula and to have a birth plan. And it goes all the way back to my own birth 33 years ago when my mum had an emergency cesarean with me and she felt really disembodied. And I guess it was a traumatic birth for her in many ways. And I had always had that story of my birth kind of overshadowing my life in a sense. Cesarean equals bad. Emergency cesarean is a really stressful thing. My mum didn't get to hold me when I was born, all of these things. And that was allowed for me. So when I found out I was pregnant, I was quite determined to work with a doula and to do so much research. She's a very type A person of what does the best possible birth experience look like and how can I prepare mentally? I wouldn't say that I was afraid of giving birth, but I wasn't exactly chill about it. So I did want to see what I could do. And I guess it's all about control, really. So got into the work with my doula. learn a lot about the induction process and how many inductions are resulting in cesareans.
There's a recent stat around 1 in 4 births are emergency cesareans, which is pretty high, 25%.
It's really high, and we have to look into why that's happening. And as I got further along in my pregnancy, talking to various midwives, my doula, doing a lot of independent research, I learned that a huge part of this is inductions taking place once you get to the 39, 40-week mark, sometimes before, depending on your own circumstances. And then things not going in a linear way because birth so rarely does, and then being forced to have an emergency cesarean in the end. So I had this big fear of that. And I had these ideas that I wanted to not rush the process. And I read this beautiful book called In Your Own Time about how women are being forced to induce and how you don't have to, and you've got all these rights and autonomy. And I got really into this school of thought around I'm going to have a natural birth. I'm going to do a lot of hypnobirthing prep, lots of meditations, lots of breath work, going as woo woo as I could with it. And that's all going to help me through this process.
To just thinking about hypnobirthing, I know a lot of women find this really helpful, but I know friends and from people I've spoken to as part of my research who've actually found it to be quite judgmental. And if you don't have your baby as per the hypnobirthing process, that actually you are almost a failure. So I think there is a bit of a caveat to say that like hypnobirthing, while some women do find it really useful, actually it's not always the right process for everybody.
I think with any very opinionated community,
Mm.
that is judgment that comes. I think we have to be really careful with any strong beliefs around the right type of birth, or, and this is a term that I want to retire really early on in this episode, natural births, because that would imply that if you don't have this beautiful, like water birth or unmedicated birth, your birth was unnatural. And we have to be extra careful because we're applying all of this language at the time in a woman's life where she's most vulnerable. So, yes, that community is loud. I love it. In an ideal world, I would have had that kind of natural quote unquote birth. I would have had my Florence and the Machine playing and hypnobirthing and candles and gorgeous, like really dimmed light. But for a lot of us, it doesn't happen. And so when it doesn't happen, you end up feeling like crap about yourself and what went on. And so I think when you are prepping, just take a lot of this with a pinch of salt. Take the bits of it that are going to be helpful for you, irrespective of the outcome. One of the things that I'll say on hypnobirthing before I go back to just my general story is that there are some very useful techniques when it comes to pain management that can be applied to any kind of birth. There are some useful relaxation techniques that can be useful for you at any stage of your life. And I definitely got that from it. But you're totally right in saying that it can feel judgmental. And I think that we run the risk of putting even more pressure on women. There's enough of that already.
I totally agree with you there. Putting additional pressure at that most vulnerable time is unnecessary. So yeah, take hypnobirthing with a pinch of salt.
Unnecessary and actually quite cruel, arguably. In my birth plan, I had envisioned a water birth that was going to take place after a long labor at home. I wasn't going to go into the hospital until I absolutely had to. I had a whole playlist ready. I'm not joking about the Florence and the Machine. Like it was that level of I want harps. I want so much like meaningful music. I want it to almost be cinematic. And I had lots of caveats in my birth plan. No students, which I still subscribe to. Um, Minimal vaginal examinations to minimize like, the risk of infection. Not being induced. Not being forced to do anything that I didn't want to do. All of these rules, let's say. And there was probably a rigidity in me that didn't want any of this to even deviate from the plan slightly. Now, I had that held up as like the gold standard, and I really believe that I'm going to manifest this. It's going to come true for me. I'm using the power of my mind. This is a low risk pregnancy. I'm an ideal candidate for this. And then I got past my due date. And what happens to me, which happens to a lot of first time mothers, and I'd love to hear from anyone that's had a comparable experience or not, I'd love to hear about your specific experience because I think we need to share more of these stories. What happened to me was that I got past my due date and I started going into really early labor. So the first thing that happened was that I lost my mucus plug. So that came out and my bump dropped all within 24 hours. I was thinking, it's happening. Get my bikini ready. I'm going to my water birth. He's coming. And then nothing for a couple of days. Then this happened over the weekend. On the Monday evening, I started having contractions and they were quite severe. I threw up. I felt like, okay, now it's happening. He's coming. This is on. Packed the hospital bag. My partner put everything by the door. We were ready to go. And then it stopped. And this process kept going on for a week. So every evening, interestingly enough, my friend told me that the evening is when you're more likely to start going into labor and contractions happening because your body is starting to relax to go to sleep and oxytocin and other hormones are coming in. So I'm like, okay, didn't happen on Monday night, Tuesday night, nothing. Wednesday night, same process, but it wasn't developing. Spoke to my doula about it, spoke to a midwife about it, and they said, oh, it's days away. It won't be long now. It's just sometimes if you're a first time mum, it's like your body kind of warming up. And I'm like trusting my process, still got the bikini packed. And a week went by and still nothing. And at this point, I'm starting to feel pretty stressed out because the exhaustion of this labor process beginning and never maturing or developing can't be overstated. It was so tiring. And I could feel a few changes. One of the main ones was that my baby was super active the whole way through the pregnancy. And then about a week into this process, I just couldn't feel him move for hours. So went to the maternity triage, walked in person, and they were saying, actually, we don't know if it's that your baby isn't active. We think it's almost that he's too active. He seems quite agitated. Ended up being monitored from half a day. I think I went in at 8 p.m. and didn't get home until like 1 a.m. It was really exhausting. And his heart rate was dropping. So it was dropping from like 180 to 100 within 60 seconds.
That must have been really scary. Like, to not feel him move, to have his heartbeat dropping. Like, how did you navigate that?
I had received lots of messages from midwives, my doula, saying that it seemed that he was engaged for birth. When I was at the hospital, I was told, actually, he's not engaged for birth at all. And so, what the doctor tried to explain to me was that maybe he'd been engaging for a bit, contractions were coming, and then he was getting agitated and disengaging. So, his head was not going down the birth canal. And I'm thinking, this is getting really scary. I'm watching on a monitor. He's failing this test that they do again and again. And that's why they wouldn't let me go home because they didn't feel confident that he was okay. So I'm watching this and it is scary. Yes, it's so scary. And you're then thinking, am I being irresponsible in sticking to my natural birth plan of not being induced, of waiting for him to come when he's ready? Because he doesn't seem to know that he can be ready. It was so confusing. And so I went from a very, very, very natural birthing movement, hypnobirthing perspective on one hand, to having an incredibly medicalized perspective on the other. And the medical perspective that I was given was that when they did a positioning scan to see if he's breached, they had no idea what was going on. They saw him, they saw he wasn't engaged, knew that I was coming up to 41 weeks. And they just said, do you want to be induced now? And again, go back to my birth plan. I was like, absolutely not. What are my options? And the doctor was really calm and kind and patient with me. And she said, look, the past your due date, you've been in this like early labor on and off for a week. Baby's agitated. You do have some options. Have you considered having a planned cesarean? And obviously, this was the polar
Mm.
opposite of what I had in mind. The one thing that I did not want was a cesarean, but I could see from how she was looking at me that she didn't want to put any words in my mouth. But she was thinking this is not going to be an easy natural delivery. And she gave me the stats that you mentioned around so often these deliveries are ending up in emergency cesareans anyway. And the way that it's going, there's a chance it's gonna be you. So it would give you some autonomy. It would give you some control, quote unquote, over something that's starting to feel really uncontrollable. And so I said to her, "I'm not in a position to say yes or no. I need to think about it," because they would have had me stay in the hospital from then on. It was Saturday night, and I'm like, "Let me just go home." Spent Sunday in a really relaxed way, and I said, "Just put me down for a cesarean if a slot comes up.
Book me in.
Book me in if a slot comes up, and I'll leave it up to fate." I got home at 1 a.m. By 10 a.m., they'd already called me saying, "We've had a cancellation for tomorrow morning. You don't have to go ahead with it. Even until you get into the operating theatre, you can still change your mind. But do you want to be that slot in that morning?" I just thought, you know what? I'm so exhausted. Yes. Let me say yes to this. And honestly, I think where that came from was this really primal, like primitive feeling of protecting my son, because I could see from the heart rate monitor, I could see this from the doctors themselves that he was agitated, that I needed to start considering my options. And intuitively, and this is the most important thing that I can say to any woman, intuitively, for me and me alone, I knew that he needed to come out and that he was struggling to come out. I don't even want to justify it any more than that because I feel like, not in a defensive way, but I feel that our intuition is incredibly powerful. And I had full body, like full confirmation that we needed to go ahead with this.
You absolutely do not need to justify yourself there. There should be, and there shouldn't be any judgment. Like, that is a decision you've made. It's a safe decision for you and your baby. There is research that backs up that gut decisions in the moment are the right thing. And actually, they're good in the moment, but they're not good for long term planning. So I think that mother's instinct, that intuition that you felt in that moment, you knowing, like actually that is not just a woo woo. It is actually backed up by research.
And that's so reassuring to hear because that was my first proper mother's instinct moment. Well, actually, going into the hospital in the first place was because I knew something wasn't right, even though I was being told you're low risk the whole way through. So thank you for sharing that. When I made the decision to go in, I still wasn't like 100% sure. And I thought, am I going to live to regret this? Because maybe he could just come naturally in a few days' time, but maybe not. And after what I saw on that heart rate monitor, I was afraid. So
Quite rightly.
I was afraid. And it was my judgment call, and it was the best decision I could make with the information I had at the time, which is all we can do. Like, sometimes I think about decision making, I'm like, well, sometimes you're 100%, and sometimes you're 51%, and that has to be enough.
Mm.
And in that moment, that was enough. I needed to go for it. Obviously, I've been working with a doula, and it was a sad moment to have to share that everything we've been talking about, everything that I'd really hoped for, was not going to happen, but that there were still things as part of a cesarean process that could happen. Playlist, for example, other things that you can do about like the microbiome from your vagina that you can still like put on. Because one of the big things with cesareans they say is, oh, they don't travel through the birth canals, don't get some of the health benefits. There are other things that you can do. So I thought, okay, well, I'm just going to go through this process, be as present as I can. And let's face it, I get to meet my baby on the other side of it. So that's all that matters. So I got monitored in the morning. Everything was fine. We were ready. Just before lunchtime, got called to the operating theatre. I've had surgery before, so it wasn't a completely alien environment, but it did feel quite overwhelming to have like the spinal injections done. And I don't think that because I hadn't been planning for that kind of birth, it felt like I hadn't had kind of the mental prep really. Remember, this decision had only been made 24 hours before, but I was just focused on healthy baby, healthy baby, healthy baby. Fuck the planning. It just doesn't matter. I need to do this and I need to meet him because he's agitated. And this is going to be the best decision I can make, as I say. So, get into the process of it. Anyone that's had a cesarean, it's kind of weird because you lose feeling from like the waist down, and there's a big curtain up, so you can't see anything and you're in there with your partner on one side and you're just trusting the process from the other side. And the anesthetist who was behind me kept saying, okay, I'm just going to meet your baby in like a couple of minutes, not long now, because you meet the baby really early. And then the rest of the procedure is actually just stitching you back up. That's the boring part, they say. So I'm there, we're excited. The anesthesia's done. We're getting ready. I've got my playlist going. And he's like, "Just another minute." And they said to me that the curtain will come down. So when the curtain comes down, you can get to see him actually being pulled out, and you're gonna hear that cry, that beautiful moment. And I have been waiting for that moment for 9 months, and well, actually far before that, but since being pregnant, that's the goal. It's a huge marathon. It's like the greatest marathon you'll ever have in your life, and you wait for that moment, that cry, to be the end goal, to be the thing that you're working towards. And he kept saying another minute. And I'm like, what's going on? I look at my partner, I'm like, what is going on? And he's like, just stay very calm, stay very calm. And at that moment, I could feel there's about 10 people in the room. It's a busy room. Everybody's energy just dropped. And I'm like, they're not putting down the curtain.
I
What's going on?
literally have goosebumps right now.
The curtain's not coming down. What's happening? And I said to him, what's happening? And he was like, just stay really, really calm. Stay very calm, stay very calm. And I'm thinking, I could spiral right now and I could start screaming, what's happening? What's happening? I can't let my mind get there because if my body is already stressed out, it's not going to help anything. So I tried my best. And that was where the hypnobirthing actually came in, to just breathe through it, wait. But the whole room was silent. And then alarms went off and 8 people ran in, and I'm not hearing a cry. The curtain's up. No one's explaining anything. They're all silent professionals, but I can read energy well enough to know that they were all scared and panicked in that moment.
That is fucking terrifying.
The best way I can describe it is that it was about 2 minutes of pure silence and then alarms going off and 8 people running in. No cry of any kind. I didn't know whether he had come out stillbirth. I didn't know what was happening and nobody was saying anything. The worst 2 minutes or so of my life, and the longest. And then this woman comes around from the side of the curtain. I'm thinking, okay, here we go. We're about to be told that he's died. Like, okay, I, I, I can't. I don't think I'm going to be able to survive this. Okay. And my mum lost a baby at 7 months, and she had a version of this, and I thought this is going to happen to me now. And it was okay. And I said to myself, I just need to get ready because she's going to tell me this. And she took like a few seconds to get her words out, and I thought, this is it. Sorry, it just makes me really emotional because it takes me back to just such a shocking moment. And she was like, okay, just so you know, we've had some complications and we're just giving him oxygen because he came out, he wasn't breathing. So we're just doing everything we can right now. And we're going to keep you updated. And I'm thinking, this is not an update. This is what's happening. And then we were just waiting. And it, it was honestly, the fear that I felt in that, I feel like I'm going to work through in different forms for the rest of my life. And I've had to be, I mean, this is jumping ahead, but I've had to be so conscious to not let it like overshadow everything because there's a version of me where I could just be afraid forever now. And then there was nothing happening for again, I don't how long it was, I couldn't tell you. It was about 2 minutes of silence. And all these people are there, alarms just going off, going off, going off. And then we heard a cry. And I was in actual shock about the whole experience. And they invited my partner to come round. So go round the curtain, and they didn't say why. I'm thinking, what is on the other side of the curtain? So I was just left paralyzed, waiting to hear something. And I heard a few cries, but nothing like much. And what was actually happening, I now know, is that they CPAP'd my son. So he came out, well, they tried to get him out, and he was really stressed. So that point about agitation was real. The instinct that I'd had, not just the heart rate I'd seen, but just that my feelings about him being agitated were real. And the incision they made wasn't big enough to get him out. And so they tried, and he was so shocked by the whole thing, they had to put him back in. And then they made the incision bigger very quickly. They took him out, and he was in shock and he wasn't breathing. So they transported him to this other part of the operating theatre. The whole emergency team ran in. They CPAP'd him to like aggressively get oxygen into his lungs, and that kind of revived him. But I didn't know any of that at the time. So I'm just there on the operating table, just waiting to hear. Partner's over there with him. he starts to cry a bit, and I was like, "What is going on? I need to see my baby. I need to see my baby. Like, this is the opposite of what I wanted. My birth plan was immediate skin to skin. I'm gonna be the first person to hold him, delayed cord clamping, all this stuff." And none of it happened. Not a single part of what I'd written down happened. And I'm talking 0% of it.
Wow. I think at that point, you are so relieved. I can imagine you would only be so relieved that you just don't give a shit about what a plan. Like, my son is healthy, he's alive. Oh my goodness.
I want to share it because I think that these stories happen all the time silently, and we move forward as women and we don't talk about them. And one of the things that I've tried to be really intentional in doing is talking about it to anyone that will listen, just to keep processing it, processing it, processing it, and to let other women in my life know that if, heaven forbid, something similar happens to them, it's not a failing on their part, and that this is surprisingly normal. Because the medical staff, once he was all okay, they were thrilled, on to the next one. Meanwhile, I'm trying to grapple with the fact that I've just had the worst moment of my life and then the best moment of my life. The emotional whiplash of that is like unbelievable. So then my partner comes back round. Side note, he did actually see my insides. Like, we've reached another level of intimacy. He's seen my stomach cut open. Yeah, and he said it looked like lasagna. So try and feel sexy after that. But he comes round and he's like, "He's here. He's huge." I'm like, "Okay, that explains a bit of it." He's like, "Got massive hands and feet." And I'm like, "But where is he?" But he was still being monitored. So one of the things that I've had to grieve is that I lost that initial moment with him. The first person to meet him outside of the midwifery team and the emergency team was his dad, which is great, but he had all those emergency people around him first. That's the last thing I wanted for him because it was so reminiscent of like the emergency cesarean that was the story of my birth that had overshadowed me. And actually, this birth ended up being more traumatic than mine was. So lots of emotions there. But then when they brought him round, it was everything. And then all of that about the birth plan, everything that I'd held on to so tightly just faded away because I had him. He was healthy, he was here, and he was absolutely fine. After that, they took us to the recovery room and he latched immediately. He started feeding. And one of the real mind fucks about the whole thing was that it was as if nothing had happened.
Do you mean that with the medical staff? They didn't acknowledge that anything had happened. They didn't try, support you through your emotions. They just moved on. And once the baby was okay, like, who cares about mom? Is that what you mean?
Yes, that's exactly what I mean. Because we're in the recovery room and they have their checks to do, right? Baby's fine, breathing, mum's okay. I had lost a lot of blood, so they were umming and ahhing whether I was gonna have a transfusion or not, but in the end, I didn't need one. And, "Oh, he's latched, he's feeding. Great, next." Tick. Tick. Great. I actually had to go to the midwife and say, "Can you explain to me what just happened in there?" Because if I didn't do that for myself, it's almost as if it was a figment of my imagination or not real, and then what would that have meant for me? I really had this feeling of I need acknowledgement of what's just happened because he's in my arms, but my brain is just playing catch up. The full body and physical shock and trauma that I was processing, in addition to the most overwhelming love imaginable, it was too much. I needed to know what was going on, especially to be the best that I could for him, because I could feel that my mentality wasn't good and that I was incredibly, understandably very shaky, but I needed some acknowledgement of what happened. And I just explained the story that I just explained to you. And then we were off onto the maternity ward and I left less than 24 hours. And so then there's the grieving process, which I think I'm still so early for me. It's such early days. I'm still processing it and I'm going to have to continue processing it around the birth was so far from like what I had planned. Yes. It was also really traumatic. And I know that there's a stat that we have that around 30% of women have complications in their births. And then 1 to 3% go on to develop like full blown PTSD related to childbirth. And although I'm not in that category, touch wood, As it stands, I definitely carry trauma. I definitely carry still the shock of it. I'd say for the first week, I was in shock. Like, I've had a couple of other shocks in my life that ain't comparable to that, but, like, you feel it in your whole body, you feel it in your mind, there's like a haze. Pair that with what you're already experiencing and going through, it's a lot. So, birth plan wise, yes, it is like fuck the birth plan because you have your baby, but it would be very easy for me, and it's very understandable that when women go through a version of their birth that is really far from what they'd hoped for, there is a grieving process. And I could really easily get into, I failed, I fucked up, my body couldn't do it. We already have all the pressure in the world on us as women from being young teenagers onwards. There's some very harsh kind of rhetoric and I think belief systems that we kind of carry quietly around it being like womanly to be able to, yes, be pregnant, yes, give life, give birth naturally, all this stuff and conditioning that I'm really kind of unpairing as much as I can.
You're not fulfilling, quote unquote, like you're not fulfilling your role as a woman if you don't do it properly. And I think there is still so much comparison and judgment if you don't have a natural birth and then you go on to breastfeed. And I think it is just having more honest conversations around like actually what real birth looks like because that's a story, a fairy tale. Some women do get that and that is incredible, but not everybody does. And I think having more conversations like this is so important. So having been through what you've been through, and I know you're still processing it, but what would you have done differently? So what would you tell the version of yourself from 6 months ago who was starting to think about this birth plan, knowing what you know now, being through what you've been through, what would you do differently?
Such a great question. I only had one plan. I think if you are going to get into birth planning, if it's beneficial for you, firstly, ask yourself if it is. Ask yourself if having a rigid plan is actually liberation or a restriction. I challenge that a little bit because there's so much that can happen. If you decide, yes, birth planning is for me, and I actually probably again, going back to if I was having a coffee with myself 6 months ago, I would say, yeah, plan it, understand more, because it did give me an amazing amount of ability to self advocate, which I wouldn't have had I not known all my rights. Have a plan A, B, C, D, E, and onwards. Have multiple versions and look at it thematically. So rather than saying, I want a water bath and I'm not going to have anything but gas and air, etc., think about the things that you could have in any type of birth situation. So even if, say, in my situation, music had to be turned off, because obviously we were in an emergency, even if it had been, there is a particular song that I really want to listen to, my water birth is completely out the window. We got into an emergency situation. Even if in the recovery room, once everything was okay, I could have played that. There's little things you can do like that. Um, Skin to skin might not happen immediately, but it's really important that I do have that experience with my baby. So I want to make sure that I'm holding him for this amount of time when I can. So it's less about the very prescribed steps and more about the themes that you want to bring into that experience as and when you can, with the health of your baby is always the priority. One of the things that I really wanted was skin on skin with his dad. So making sure that that happened, and that happened way later than I'd hoped for, but it still happened. So how can that look? The other thing that I did was my placenta, which I mentioned in a previous episode. That still went ahead, but not in the way that I'd envisioned, which was like I wanted to like see it and everything else. There was no time for any of that, but we still did get my placenta encapsulated, and I am now taking it in a supplement form. So just looking at the things that, like, there can't be non-negotiables when you're dealing with things like, in my case, it was a medical emergency, but there can still be little golden threads that can apply to any kind of birth. That would be my advice. Think about it as more themes rather than like prescriptive steps, because none of us are in control. Doctors, mothers, like none of us are in control of this. Doulas, with the best will in the world, we're all just here for a healthy baby, however we get to that point.
So the healthy baby is the non-negotiable, and then
Non-negotiable.
everything else is nice to have. That would be lovely. We'll figure that out at some point throughout this experience. Okay. That's
Yeah.
really, I think, really helpful to have that kind of perspective on it. And you mentioned there, like, decide if you want to do a plan. So I'm not a type A personality. We've spoken about this before, and I feel like I would probably just go into it with no plan. Like, maybe some things that would be nice if I could make them happen, but like, I don't really like to plan anything anyway. So I don't think I would have a birth plan. What what do you think, I guess, are like the pros and cons of having a birth plan versus not having a birth plan? So you mentioned the self-advocacy piece, but is there anything else that you think is really important to either side?
I think knowing you're right is really important. I think understanding the hormones that play a role in birth is also important. So you don't need to get into the realm of planning and writing everything down and giving out laminated copies to everybody in the room, but you can understand, okay, so what does early labor actually look like just ahead of time? What is that process? What needs to be in play to get there? Understanding what your body is doing, like the role of oxytocin, for example, like the love hormone, that like connection hormone. What is the role of that? Having a little bit of knowledge is power before, if in your case, before it gets into being overly prescriptive. So, pros, absolutely understanding a bit more about how birth works. There's so much that we're not taught that I think is useful to know. Cons, if you understand too much, you're going to expect yourself to go through that really linear birth. And then when that doesn't happen, that's going to bring up some stuff for you. So I think get the information as far as it is useful for you, but don't put all that pressure on yourself for it to go a certain way. Because if you hold on to things too tightly, often they break.
I think that's really incredible advice. Thank you for sharing. And thank you for being so open about your experience, because I know that that will help other people listening. And I know that was really challenging and difficult for you to talk about. So I'm really grateful for you being so open. There is some research around the impact on traumatic births and the increased anxiety that comes with that, and then the increased anxiety with returning to work and how that looks like in the workplace context. Has any of this experience made you think twice or change your mind or reevaluate anything that you thought about your return to work journey at this stage?
Yes, which is the abject terror at leaving him, which I haven't done yet. But I have had some time apart from him when he's with his dad. I haven't had that with anyone else yet. So I'm trying to take it in baby steps because I am conscious that what happened to me in that operating theatre at his birth will have shaped parts of my brain that are going to make themselves more and more known as time goes on. And what I don't want to do is be so riddled with anxiety that it means that I can't be the best mum that I can be for him.
Mm.
There's only so much of that I can control. I have to give myself a huge amount of empathy and understanding that it's inevitable that after what I went through, I'm going to be hypervigilant. I'm going to be over indexing on certain anxieties. Of course I am, but I can't let it dominate my entire life. And if it does, I need to get help. I need to talk about it. As I'm talking now, I need to talk to someone, a therapist. I need to like ask for help and put my hand up and say, actually, I am feeling overly anxious. Because if I do get there, it's understandable that I do. So when I come to my return to work, I'm afraid, not from working from home, but of going to the office, not being there, not seeing him, not hearing him. Because you have to remember that I didn't hear him for the first couple of minutes of his life. And those are the longest minutes of my life, waiting to hear that he was okay, waiting to hear his cry. So you can imagine that, funnily enough, every time he does cry, I love it. I'm like, you clear out your lungs, baby. You express yourself because I didn't hear his cry.
Mm.
So being away from him is going to be the big challenge for me. And I'm going to have to start. Not yet. He's super young. Like we're only 2 and a bit weeks in, but I'm going to have to start maybe going to the cinema and leaving him with my mum for a couple of hours and working that muscle because I know that that muscle is like really weakened by what happened to me.
I have a friend who forced herself to leave her daughter with her mum, only round the corner, only for a couple of hours. And she said the first time she did it, she sobbed, was so like heartbroken by it, but she knew that the reality is she's going to have to go back to work. Her rationale, which I think is like completely logical, you're going to have to leave them eventually to be with them 24/7 for 9 months up until the moment you put them in nursery. And then, of course, it's going to be a shock to the system. Of course, it's going to be much difficult. And I know it depends on everybody's context. It's going to be harder for you if you don't leave them. And I'm saying this as someone who isn't a mother. So, give me a couple of years and when I'm living the experience, we'll revisit this. I might have a very different opinion. But I got her logic. She almost forced herself to do it. It absolutely broke her heart. It was only for a few hours. But the more she did it, the more she got used to it. And her daughter loves being around other people now. When it came to her going back to work, it wasn't as challenging because from a very early age, she left her with her mum, she left her with friends, she left her with people, which, wasn't comfortable for her at first, but she got used to it and she navigated it. And again, that rationale of being like, I'm going to have to leave her at some point. The sooner we get used to it as a family, the easier it's going to be when I do go back to work. So yeah, I thought that was sound logic.
Yeah, it is. It's that incremental piece. As with anything challenging in life, I'm not going to be able to leave him for a weekend and be okay. But can I challenge myself, exactly as you say, for me and for his confidence, to start that process really gently? I have to. But it has manifested for me in so many ways around when we first put him in his cot, being like, no, 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 I'm just going to stay up all night and hold him. And I have had nights like that, but it's not sustainable. And as he gets stronger and bigger, like we're recording now, and he's out at the supermarket with his dad. And do I feel like I have like a phantom limb missing? Yeah, I do. I feel like a part of me is missing. But I want him to be the most fulfilled, as you say, like sociable little boy. I want him to be really confident in the world. And he's looking to me for that confidence. He's looking to me as he grows up to feel like he can go out there and explore and do things. I always liken it to Glennon Doyle has this amazing quote about how with your kids, you're like, imagine you're on a flight and the air hostess is handing out some like peanuts to everybody. And suddenly there's a huge amount of turbulence. Everybody is looking at that air hostess to see if she's freaking out or not.
Mm.
It's the same thing as a parent.
That's the first thing I do in turbulence is I look at what the air hostesses are doing.
Yeah,
If they look panicked, then I'm panicking. If they look fine, I'm chill.
exactly. Our kids are looking at us in that same way. So I need to work on it. And that's the vulnerable thing. He means everything to me. He's like the great love of my life. I absolutely adore him. And I've had a sharpened perspective on what matters in life. But I also know that to be the best mum that I can be to him, and I already feel this, I need to work. I need to have that part of my identity too. So what that looks like, I don't know yet, but I know that we'll be sharing it on this podcast.
I love that. There is that saying, isn't there, around it's not about what you tell your children to do. It's what they see. It's how they see you show up
Yeah.
and act. So if you are leaving them confidently, if you're crying every time you're leaving, like that's going to have an impact on them more than if you're like, have a wonderful time. I'm going to work. I'm going to do what makes me feel good and make me feel fulfilled in my role, make me feel good, then they feel good about it. Because if you're like, I'm so sorry I have to leave you to go to work.
Yeah.
I'm crying, I'm leaving you. Mummy doesn't want to do this, daddy doesn't want to do however the family dynamic is. I think that impacts them more than you confidently leaving them. And I do think it is, baby steps. Again, saying this as someone who is not a mother. Let's come back to this in a couple of years and see what I think. You mentioned earlier in the episode the term you would like to retire is natural birth.
Yeah.
What would you like that to look like instead? How would you want people talking about this?
I don't want people to categorize themselves as natural or unnatural for needing medical intervention to bring their beautiful babies into the world. There's nothing more natural than the fact that you've grown your baby and you're bringing life into this world. So, what happens at the time of birth, largely out of our control, does not make you or your baby unnatural. Can't we just call it birth? Can't we just categorize all births as giving birth and huge achievements and things to be so incredibly proud of? I just think drop the natural, unnatural, because the implications of that are shaming for women. And I have to work overtime in my mind to think, well, I didn't, the other day someone asked me about a push present and I was like in my head, well, I didn't deserve one because I didn't push. And I thought, I carried a baby for 9 months. That's the main event. Surely it's not just reduced down to what happens at birth. What about everything that came before it? And crucially, everything that will come afterwards. So getting rid of natural and its implications, I would say.
Maybe replacing natural with safe, and maybe replacing push present with just a motherhood gift.
Let's retire all the terms. I've got a few thoughts. I love your rebrand. But yeah, those would be my main ones.
Thank you so much for sharing your story. And as I said earlier, I know so many people will find this really helpful to listen to. Thank you for being so open and vulnerable and honest as always. It's been a pleasure chatting with you.
Thank you for listening. And for anybody listening to this who wants to share their birth story, just because I think it's healing for us, please reach out to us at hello@matressenceunfiltered.com or Instagram, of course, @matressenceunfiltered.
Thank you all for joining us today.
If you've taken something from this episode, we'd be so grateful if you shared it with a friend.
We'd also love to hear from you. Find us on Instagram, TikTok, and LinkedIn. And please share your questions, comments, and experiences. This is a conversation we want to build together.
Until next time.